Welcome back to Critical Moments with the Neonatal Nurse Educator, Part 16. This week, in continuing with our late preterm infants, we are talking about what to discuss at discharge, and I'm giving you some scripts that I use as a NICU nurse when discharging late preterm infants. One question a parent may ask you is, when my baby first came here, they needed that heat to keep them warm. How do I know I'm going to be keeping them warm enough at home? And I remind them of a few things. First, you're probably going to be holding your baby a lot, which is the best way to actually keep them warm, and often doing more skin to skin at home than you ever did at a hospital. But because these babies are often born with thinner skin, less brown fat, and can have a hard time maintaining their thermal regulation, we recommend you keep your house temperature between 70 and 72 degrees. 69 might be okay. We recommend that you dress the infant in one more layer than you are currently wearing, that a hat is always a great place to get extra warmth. And then if you're worried about the baby, to check the back of their neck or their core. Never just feel their hands or their feet and say to yourself, oh my gosh, this baby is so cold. Because likely their perfusion may not be perfect for that, especially if you're doing skin to skin. So really looking at what their core temperature is. You do not need to take your infant's temperature every 3 hours when you get home, just like we do. In fact, I would recommend taking it a few times when you get home to make sure they've acclimated to your environment, and then using your body as a sense of how they're doing. Now, they may not always feel cold if their thermal regulation is challenged. You may notice that they're not eating well. You may notice that they're lethargic, and then I would go back and check some more temperatures. But these are some key points you can use during your discharge teaching.